Thank you, Mayor. And I can't underscore enough the Mayor's comment on the need for people to get vaccinated. Today in Houston, we're seeing a huge increase in the viral activity in the community to the point where if you are currently unvaccinated, you need to consider that you represent a potential danger to yourself and others, and most particularly your own family, because we have found that those who get infected are most often infected by another family member. If you look at the graph, you'll see that the positivity rate is coming up extremely rapidly. This is a huge increase over just several weeks. It's about a month from when it had that low point to the high point that you see now. As we go forward, we can only expect that that is going to go up more. And you can see that our cases over time, and this graph, like the one before, it compares the two big previous waves that we had, peaking last July and then peaking in January of this year. And you can see how steep this curve is rising, which you have to considers the momentum of the viral spread. And it is continuing to go up very, very sharply. We're seeing that our hospitalizations are also going up. And this is where, when my comment saying you represent a danger to yourself and others, is vitally important that you understand. The hospitals right now are full. The emergency departments are holding as many as 30 admissions in some hospitals, waiting for beds upstairs that simply don't exist right now. Hospitals are having ambulance crews stay with patients in the hallway for hours on end because they don't have enough room in the emergency department, because they don't have enough room in the hospital. So consider that many of these patients are COVID patients, but many of these patients are also heart attack patients. They're inflammatory bowel disease patients, they're stroke patients, they're car accident patients, they're moms in labor. There are other things that occur that are also getting backed up. And so while you may be thinking of this COVID situation and say, I don't need to get vaccinated, I don't think I'm going to get it. Well, if you're not vaccinated, you may get it. In fact, the way this is spreading, it's almost certain that you're going to get it. This virus is so extremely contagious, your chances of getting through this without having become either vaccinated or infected is essentially zero. So if you're unvaccinated now, you represent a risk to yourself of getting sick, to your family members that they may get sick, but also just because you're helping spread the virus in the community, heart attack patients, stroke patients, car accident patients are being brought to hospitals that just simply do not have the space to handle them, to the point where they're sitting on ambulance crews to staff the emergency department. And that's why you represent a risk not only to yourself, but really to the entire community. And we have got to break this chain. And the way to do it is by getting vaccinated. It's simple. Over 2.5 billion people on the planet have been vaccinated. If there was a problem with the vaccine, we would know it by now. So for those folks who say, well, I'm not so sure, I'm a little afraid, I don't know what you're afraid of. We are detecting problems, the rare problems, to the point if a problem occurs, 1 in a million times, we know about it. That's the level of scrutiny that this vaccine has gone under. Far more scrutiny than any vaccine in history. It is a safe vaccine, it is an effective vaccine, and we need people to get vaccinated because our momentum is going in the wrong direction. And finally, this chart is a little complicated. When we first started testing the wastewater, with the first wave, when we had wastewater testing, was back in July of last year, over a year ago. And when we peaked at that, we set that value, the way you measure it, it's very complicated, but we set that value arbitrarily as 100%. After that peak last July, as we came down from that peak, from that wave, the amount of virus in the wastewater, of course, went down. And of course, the wastewater predicts what's about to happen about 2 to 4 weeks ahead of time. So we saw the value in the wastewater dropping before we saw the positivity rate drop and before we saw the hospitalizations drop. So it's extremely reliable. So if you consider that last July 6th was 100%, in June of this year, with that peak, it got to 250%. 2 weeks ago, we were at 231%, and last week we were at 370%. So the virus in our community is spreading rapidly, it's spreading everywhere, it is spreading very intensely, and we are at a level of virus in the wastewater that we have never seen before. And the wastewater predicts what we'll see in positivity by about 2 weeks, which predicts what we'll see in hospitalizations by about 2 weeks. So our situation in the hospitals, which is already dire and dangerous, I can pretty much guarantee you is only going to worsen over the next 4 weeks. So please, get vaccinated.